Jolene. Gotta get another round of applause for Jolene. All right. Okay. So just before I get started, make sure everyone sign in. That's important for me. And then also their bathrooms are on, the restrooms are on the left side of the building, past the photo of, I forget her name. Anyway, on the left side, if you need those. All right. All right. So I want to introduce our guest, our keynote speaker. So Ethan Evans is a distinguished graduate of UC Davis with nearly 25 years of experience in various aspects of program management, various aspects of social services, including direct services, delivery, program management, research, peer mentorship, and policy and analysis. He holds a master's of social work degree from Sac State School of Nursing. School of Singers, okay. And he currently holds a full-time position as a faculty member there with aspirations of achieving tenure in the near future. Within his role of Sac State, Ethan specialized in teaching advanced policy courses within the health and aging concentration, grant writing, and research. He takes pride in mentoring students as they work towards completing their capstone and thesis projects. Outside of academia, Ethan is actively involved in the community. He sits on the board of directors for the Sacramento Regional Coalition to End Homelessness and is engaged with the United Way California Capital Region and leading evaluations of their guaranteed income program pilots. Please join me in welcoming Dr. Ethan Evans.
All right, hello, social workers. And hello, esteemed guests. I'm super happy to be here at the Betty Irene Moore School of Nursing. I can see a day when there's a school of social work in this region with one of your names on it, or maybe one of the names of one of the people you serve, leading social workers into the next millennium. Daniel, thank you so much for inviting me here. It is a real pleasure to help recognize social workers and the great work that you do in the Sacramento region. You promote and enhance our well-being, and that's a huge lift. So nice work to you. I also want to thank Kristen for coming to support me and sharing this experience. You know, when I was 14 years old, I said out loud, I don't need other people. And I meant it. And I thought this was the principle that was going to lead me in life. And wow, I was wrong. Truth is, without others, I'm very little. And, you know, my late parents, Chuck and Sue, through their service to the community, demonstrated the principles that would ultimately lead me to this profession. And I'm sure each one of you here has a story of how you got to your seat. And, you know, as my parents and many mentors and friends and at times paid professionals who helped guide me and keep this ship afloat and headed in a reasonably good direction. And so I'd like us to take just a moment to ourselves to acknowledge all those who've preceded us and helped us along our way. So today is about you. It's also about us. It's about empowerment and the pursuits of social work. Before I begin my prepared words, are there anyone here who earned their master's degree at Sac State? Right on. Me too. 2002. And I hope I help advance many others. How about USC? All right, another handful. And ASU, anybody? University of the Pacific, new master's program in the region. How about Azusa Pacific? Right on. Any other places that I haven't mentioned? San Diego State, anywhere else? Adelphi? Others? UGA? All right, where's that? Columbia, fantastic. Welcome out. Well, not welcome. You've probably been out on the West Coast for quite some time. We've all come to UC Davis to practice our craft. In short, social work rocks. The full title of my talk today is really Empowerment Rocks, a meditation in 3 parts. Part 1 is about you, social workers in a healthcare system. Part 2 is about our theme, empowering social workers. And part 3 is about power, the power in empowerment. Your work rests in a long tradition. Medical social work began in Massachusetts General Hospital in 1905, when Ida Maud Cannon developed the first social work department in a hospital in the United States. Ida earned a nursing education in 1898, but then heard a lecture by Jane Addams about the living conditions of the poor. And Ida joined the School of Social Workers in Boston. She then graduated from there. Her goal at the time was to make medical care effective and to cure tuberculosis. That ailment accounted for 1/3 of all deaths of people between the age of 15 and 54 at the time. It inflicted severe emotional and economic strain on the patients, but also their families. The movement really started from there. In 1917, Cannon published a book called Social Work in Hospitals, a contribution to progressive medicine. And in 1918, co-founded the American Association of Hospital Social Workers. Her book sketches how medical social work was being practiced in hospital departments that were springing up around the country. She visited them, she commented, all the paid workers were women. And interestingly, a few men, mostly from the medical schools, showed their interest by volunteering. So, as her notes say, she also wrote that hospital social service throughout the country reveals a striking uniformity in the problems presented to social workers. Although the organization of the departments and the methods differ greatly. In general, the social workers struggle with the questions involving in dealing with tuberculosis, patients needing convalescent care, the sick tenement child, homeless men, sick and unfit for work, the lone girl facing a dishonored motherhood, the industrial problems of the physically handicapped, the feeble-minded, and the insane, with their need of protection and control, the haunted slaves of drugs and alcohol, the sufferers of venereal disease and its consequences, the patients stricken with incurable illness, needing institutional care, and the victims of Black despair who attempted suicide. In short, Cannon explained, each patient presents not only a medical problem, but a social one as well, and asserts it's because of the complexity of social problems involved and the interdependence of medical and social treatment that the social worker is needed in our hospitals. Sounds like her words work for today. A little antiquated, but very similar. I searched the websites of UC Davis this week and found various descriptions of your work as medical social workers. At the Children's Hospital, it says, patient-centered care is at the heart of everything we do. Our support services help patients and their families through their medical journey and ensure that they receive all of the help they need in their healing process. Medical social workers are available to assist a child or their family in coping with hospitalization. At the adult oncology clinic, medical social workers help patients to adjust to life after diagnosis, explore the impact cancer and treatment have on their work and families, and make advanced care planning decisions, among other things. And all across campus, LCSWs offer behavioral health counseling, help patients focus on strategies to cope, adjust, and improve emotional well-being. They lead skill-building classes and address barriers to care. As social workers, you are your patients and often each other's. Your colleagues rock. You're reliable, consistent, dependable. You show up when things are hard. You are Lorianne Baker at the Alzheimer's Disease Clinic. You are Matthew Evan Garolamo at the Behavioral Health Center. You're Fabiola Mendez, Brena Rezan, Annie Tao, Katie Winnestorfer, You're all the social workers at UC Davis. Ida Cannon wrote something else in 1917 that I think aptly applies to you today. She explained, it's often with a spirit of adventure that hospital social workers face their day. She, the hospital social worker, could never know what tragedies, what joys, or what wonders of human nature may be revealed to her. Animated by intimate relationship to the vital experiences about her, she's eager to contribute whatever skills she may have to the service of hospital patients. This is why we honor you today. Your work can be grueling, even with its rewards, it's hard. You know, rocks by the sea are battered by waves every day. This begs the question, how can social workers not get worn down by the elements? How might they be fortified, be empowered? This brings us to part 2, empowering social workers. On our behalf, the National Association of Social Workers declares, although the demand for a profession grows, social work has been under-resourced and underappreciated for far too long. Empowering social workers aims to highlight our profession's impact in all facets of our society, while also calling attention to the burnout and underpayment of social workers. I'm sure you've experienced both of those even in a large institution like the one you're employed in. This month, NESW calls on our communities, like Leanne mentioned previously, and advocates and policymakers to support legislation and initiatives that empower and strengthen the social work profession. And with that, I imagine you share this fear with me, that our call will fall on deaf ears or be simply ignored. However, several advances that have been going on at multiple levels are cause for optimism. First, the most local. Creation here in Sacramento County of the Community Wellness Response Team empowers social workers. The nation has sought answers in the wake of repeated acts of police violence. Sacramento, too, faced its own tragedy. Stephon Clark was killed 6 years ago, several days ago, on March 18th, 2018. In 2020, Sacramento County Behavioral Health Services began to work with community leaders to design alternatives to calling 911 for behavioral health or quality of life crisis. Now, peer responders and mental health counselors, not the police, answer calls to 988. During the month of February, the alternative line received 1,477 calls. 26 were referred for engagement of the response team. This resulted in 21 cases being stabilized in the community, with 1 transport to the mental health urgent care clinic. None resulted in a police response. Their hardest thing to get that going was not political will, it wasn't community support, and it wasn't money. It was hiring qualified social workers who wanted to do the job. It delayed them for 2 years getting off the ground, and they are staffed at a time now that they're deploying workers. If your friends are graduating from social work programs and want to move to Sacramento, there is work for them. And I was surprised they make much more than a college professor. So good work. I read a success story from their work recently. A senior citizen contacted 988 with reports of chronic anxiety throughout most of their adult life, which significantly worsened during the pandemic. The pandemic had negatively impacted this person's employment, income, and social relations, which had led to increased isolation, withdrawal from natural support systems. This person had reached out to 988 and CWRT for support to de-escalate the immediate crisis. CWRT was able to link this individual to a medical team for an in-field assessment and provide low-cost resources for further medical and mental health evaluation and ongoing services. And that call line is available 24 hours a day, 7 days a week for folks to, on themselves or on their loved ones or on someone in the community, call a different response in Sacramento County. At the state level, the implementation of CalAIM provides the policy and framework and financial resources to empower social workers. In essence, CalAIM integrates medical and social care at the local level. A sample of their community supports includes housing transition services, medically supportive food, and enhanced care management. I'm sure you're, particularly in the ER, you're familiar with these CalAIM services as you and your colleagues look for discharge planning for homeless individuals who the state has now said hospitals better figure that out before they have them move out the door, right? Luckily, they've followed up with some money and more recently, more through the Behavioral Health Services Act and the passage of Proposition 1 to fund actual housing and psychiatric beds and associated services that will further the goals of the original Mental Health Services Act across the state. I do know that there was some contention and some opposition to that Proposition 1, some concern about the reallocation of funds and what might not be funded. These are legitimate. There will be a bit of a shift of focus from some types of neighborhood-based services in favor of funding more housing development. In a market like this, you know it. If we don't have housing, I mean, I don't know, it's tough. At the federal level, last year, the Centers of Medicare and Medicaid Services adopted policies that will empower social workers. They finalized some payment rules that will expand access to behavioral health care services, allow social workers to bill for treatment, and pay for services to address health-related social needs and that impact care. And then just 4 days ago, the Biden and Harris administration announced a new model to enhance primary care, funding and incentivizing team-based care approaches to medical and social needs. By investing in our workforce, social workers are better equipped to address societal issues, provide crucial services across many systems, and provide the health and well-being of our clients and for our communities. Of course, there's room for more to be done, and I encourage each of you to join with the NESW California chapter and help push for additional needed change. Let me turn to part 3, power in empowerment. Truth be told, as a student, a practitioner, and as a professor, I've always felt a little iffy about the concept and word empowerment. I went into master's program right after the 90s when this had become a thing, like we see many things that become. And, my hackles go up even more when it seems to justify self-interest. Just kind of makes me like, ugh. In my ideal, social workers work with people, not for them or on them. And empowerment requires solidarity. And solidarity requires social, not individual work. On the shores of empowerment practice, there are rocks that can crash our ships to bits. Let me explain. Empowerment practices are rooted in an understanding of power, personal, social, and structural. Consciousness and transformation, interactive systems, the importance of relationships, and the long history of societal dehumanization of marginalized communities. However, empowerment, as it's practiced today, is susceptible to cultural practices and political agendas. We live in a culture of stark individualism, driven by an emphasis on scarcity and the promotion of profit and personal gain at all costs. Over time, the definition of empowerment theory and its associated practices have devolved into a focus on individual responsibility to the exclusion of the ways that social structures create, maintain, and perpetuate social problems. It's critical that we resist the inclination to separate micro-level factors from macro-level conceptualizations of problems and solutions. It's easy to fall into a decades-long bifurcation of either being a macro or a micro social worker. To resist, it's important to return to the origins of the term's meaning to understand its true role and application in social work practice. In the field of social work, empowerment was made concrete as a concept by Black social work scholar Barbara Solomon's book, Black Empowerment, Social Work in Oppressed Communities. In your work, carry with you the originally intended values and belief of empowerment theory. Interactive systems are a part and play their part in every case. The human condition is generated from three entities: the individual, the environment, and the interaction between the individual and that environment. Principle one. The second principle, social justice is desirable. In the context of empowerment, social justice is characterized by equitable access to resources, knowledge, civil participation, power, and decision-making. The third value or belief originally intended, power is a tool for inclusion or exclusion. Power is present in all interactions. Power influences our thinking about behaviors towards ourselves and others. Inequity, bias, and social exclusion result from the belief that power is a limited resource that must be guarded and used. This leads people positioned with power to overestimate their work's value and either underestimate the worth of other people or believe them to be incompetent based on stereotypes and biases. When power is enacted in this way, it leads to historically marginalized people to underestimate their own work and worth. Empowerment instead redefines power as a resource that can be possessed simultaneously by multiple people. Power in its various forms is the foundation of community self-determination and social change, whether it's the community of social workers, the community of Oak Park residents, or the community of any group that you work with or have been a part of. The fourth belief, consciousness transformation leads to change. Transformation refers to a dramatic change of perspective. Consciousness transformation shifts the problem focus from the individual to the entire system. Under it, we understand the larger societal dynamics. Historically marginalized people have an opportunity to utilize tools, analyze the barriers, and advocate for the needs of their communities with other like-minded people to form a collective voice for change. Application of these four assumptions is fundamental for empowerment practices to work. Social workers at UC Davis. Empowerment practice is one of sharing knowledge that reveals the implicit and explicit social messages about the lack of value, worth, and inadequacy of peoples, and the messages that obscure pathways of how advantaged utilize power to their advantage. Ultimately, sharing knowledge as an empowerment intervention creates the opportunity for people to gain particular skills, knowledge, and sufficient power to influence their lives and the lives they care about. Social workers at UC Davis, I care about you. We all care about you. That's why we're here today for lunch. You rock, and empowerment rocks. Thank you very much.
All right, and in true social work fashion, we can't give you any money, but we can give you a certificate and a orchid. Thank you.